Good morning. My name is Andrew Blustein, and I'm the chairman of Garfunkel Wild. Thank you to all the hundreds of registrants for today's virtual healthcare and ASC symposium. Last year, we did our first virtual symposium, and I thought we were never going to have to do it virtually again, but here we are. COVID's still a thing. So we had some glitches last year. We think we've ironed them out. But of course, we miss the presence that we've built up over the last 8 years, and this community keeps growing. I think, though, there is some benefits to having a virtual. One, because the expenses are less, we could do it for free. So if you want to make a donation to ASCO or your local ASC association, please do that. Also, it allows some flexibility. We don't have to worry about weather and people missing flights and things like that. So we're going to be sending out a survey, and you'll decide, should we continue to do virtual, or should we, assuming the pandemic goes away, should we go ahead and go back to our traditional format? Okay, this has been a very tough year for everyone, for healthcare in general, ASC, physician, healthcare management specifically. But we can see that lessons have been learned, that there's a lot that we persevered through. And what we wanted to do today in the agenda is kind of provide some real life experiences so that you could have some takeaway messages, and also have things to think about, maybe to help increase revenue or have a better work environment. So we're starting with our State of the Union. We're going to have both federal from ASCA representatives, as well as New Jersey, Connecticut, and New York ASC associations. We then are going to an expert provided by Physicians Endoscopy, who is an OSHA specialist. We think that's very timely, and that you'll learn a lot from that. That is from 9:45 to 10:15. We then know that managing HR issues are a tremendous burden. Everybody is having issues. And so two of our partners from Garfunkel Wild, from 10:15 to 11:15, will be doing the top issues of the day for HR. Then we're having Garfunkel Health Advisors. They're going to be talking about coding and medical records, obviously two very important components of all healthcare practices. That's going to be from 11:15 to 12. Also, despite everything that's going on, there's a lot of consolidation going on. So I want to thank the Bloom organization and Merit Healthcare for sending their representatives to talk about that consolidation. That's from 12 to 12:45. From 12:45 to 1:45, we got together a group of administrators, different parts, different locales, to have a roundtable to discuss issues that everyone's experiencing. Then we thought this was a neat topic, establishing a 23-hour stay program. Dr. Joel Buckhalter is speaking, as well as a representative from Merit. And then we know that everyone's concerned about money. So we are having the Coker Group team up with Garfunkel Wild from 2:30 to 3:15. And that should be very useful to learn about how to deal with payers and strategies. And finally, at 3:15, we are going to have a live question and answer. So come back. You can send us your questions throughout the day. There's also a chat box, and you can ask those questions. So save them up, because I know it's virtual. You're not going to have that opportunity. And I really want to thank everyone, all the speakers and everybody who put their effort to make today a success. Thank you very much. And with that, I will turn it over to the first session. Have a great day.